I'm Dr. Jen Bochnowski here at Lowell Animal Hospital, and today I'm going to talk to you a little bit about something we see very commonly, which is ear infections in dogs and cats. Oftentimes what an owner will notice at home is that their pet is either scratching at their ears or shaking their head very frequently. Sometimes they'll also notice an odor in the ear or a lot of exudate or debris in the ear, especially if they're cleaning them very frequently. This is a picture, of course, of a dog's ear, and for the most part it looks fairly normal as far as any inflammation or anything like that, but you are starting to see a little bit of brown debris built up here, so that could be the sign of an early infection. And then as the infection were to progress, you would probably see redness of the ear, some swelling and that sort of thing. So those are some things you'd visually see in the ear canal itself. And so when an owner does bring a pet in, we'll do an ear cytology first. So we swab both ear canals and look at the debris under the microscope. What we're looking for is whether or not the pet is infected with yeast or bacteria, or potentially both. And that way we know which ear medication is appropriate for that particular patient's infection. So we'll clean the ears very thoroughly, do an otoscopic exam, and look down the ear canal for any masses or foreign material that might be down in there that could potentially be an inciting factor for the infection. And then we also want to make sure that the eardrum is intact before we clean them or put any medication down. So we clean the ears, treat with the appropriate medication, either with a long-acting ear medication that we'll put in here in hospital, or sometimes we'll send home ear drops for the client to use at home. Generally speaking, we'll have the pet come back in about 2 weeks just to make sure the infection's totally cleared. If it's not, or if the patient continues to have these infections, every few weeks or months, then we want to start looking for underlying causes for frequent ear infections. Just a few of those things can be something like food allergies, dogs that go swimming and their ears are wet a lot. Certain breeds are predisposed to chronic ear infections just based on the conformity of their ear canal, the amount of ear wax, if you will, that they produce. And so those are some of those things we'd be looking for if they continue to have chronic infections. Another thing we might do with these second and third infections that dogs and cats come back for would be to culture the ear and make sure that the antibiotic that is grown, basically to find out what is the appropriate antibiotic in case we just happen to be treating with the wrong one. And so, again, if you're noticing that your pet is shaking its head a lot, scratching at its ears, or you're noticing this foul odor, anything like that, it's really important to get them in right away because overall it's very painful and of course uncomfortable for the pet. And they can have some chronic changes with the ears with long-standing infection that makes it more difficult for us to treat and for them to just kind of live with. So